The blame game over the procurement mess at KEMSA continued Wednesday, with the Public Procurement Regulatory Authority pointing fingers at the Health Principal Secretary Susan Mochache and KEMSA CEO Jona Manjari. Now, the authority's Director-General Maurice Juma told the National Assembly Committee the duo directly influenced the sourcing of equipment to fight COVID-19.
Parties mentioned in the scam at the Kenya Medical Agency continued pointing fingers at the Ministry of Health, claiming top officials at the ministry are to blame over the loss of billions shillings of COVID-19 funds. Public Procurement Authority Board, while appearing before Joint Senate Committee on Health and COVID-19 Situation, claimed PS Mochache directed KEMSA CEO Jona Manjari to abandon all other procurements that had been initiated and use a list of companies containing a letter of supplies from her office. Further submissions before the committee indicated that KEMSA CEO erred and breached the procurement law in issuing commitment letters.
This particular case should have had a registered list of suppliers from where it should have, borrowed and used in this process, or even borrowed a registered list of suppliers from another government entity. We have not seen those records.
The authority further told the committee that their efforts to probe irregular procurements were subjected to frustrations, even as they decried a strained budget to investigate corruption claims.
We find that entities are not awarding tenders to the lowest evaluated bidder in some cases. They disqualify low bids, and then they go to higher offers without giving sufficient justification why these are happening.
The authority, which says it has launched investigations into the procurement at KEMSA following a directive by the committee, also says 200 investigators are not sufficient to expeditiously probe corruption cases in procurements, calling for additional workforce. For Channel 1 News, I'm Gladys Mungai.